Astaxanthin is a red pigment and it's found in fish, shrimp and some microalgae. It's an important antioxidant and it can help with skin aging, cardiovascular risk, it can protect the heart and modulate the immune system. Astaxanthin is a naturally occurring orange-red pigment carotenoid found in algae, shrimp, lobsters, crabs and salmon. It's made by a green microalgae and by a yeast. The green algae makes high amounts of this antioxidant pigment when it's exposed to unfavorable conditions such as high UV light exposure to reduce the damage from the free radicals. Animals that eat the microalgae or the yeast take up the astaxanthin. This explains why the wild shrimp, lobsters, crabs and salmon have bright red orange colour. The wild salmon can contain up to 26 to 38 milligrams of astaxanthin per kg of body weight, whereas farmed Atlantic salmon typically only has 6 to 8 milligrams. Although it's also a carotenoid, the astaxanthin is not converted into vitamin A in the body. Like other carotenoids, the astaxanthin has self-limited oral absorption. Very high doses cause no toxicity signs in rats. Astaxanthin is a highly fat-soluble substance, which means that it's better absorbed when it's consumed with fats. When the astaxanthin is ingested, it's digested and absorbed in a similar manner as a fat. It's assembled into chylomicrons. The chylomicrons are absorbed into the lymph circulation before the remnants of the astaxanthin are digested by lipoprotein lipases. Astaxanthin is then assimilated into lipoprotein particles to get transported into the tissues. This means that the astaxanthin can more readily affect the metabolism of fat and cholesterol, especially when it's related to cardiovascular health. In rats, the ingested astaxanthin was metabolized by first-pass liver metabolism, primarily by the cytochrome P450 enzyme. Astaxanthin has been identified in most tissues, but not in the heart. Some of the benefits of astaxanthin are its antioxidant and immunomodulatory effects. It can protect the skin, it can help with exercise fatigue, it can reduce the risk of heart disease, it can protect the brain, and it has few reported adverse effects. As an antioxidant, astaxanthin is 10 times stronger than zeaxanthin, lutein and beta-carotene, and 100 times stronger than vitamin E. The structure of the astaxanthin allows it to enter cell membranes or to stay outside of the cell membrane, allowing it to protect the cell membranes from both the inside and outside of the cell. In a small trial on 30 women and 36 men, a treatment combining oral and topical astaxanthin reduced wrinkles and age spots while improving skin elasticity, texture and moisture. Oral astaxanthin alone had similar effects in another trial on 34 middle-aged people. Supplementing with the astaxanthin and collagen improves skin elasticity and integrity, while reducing the production of two proteins that break down the collagen, in response to UV radiation in a clinical trial on 44 healthy people. In another trial on 23 people, oral astaxanthin reduced skin redness and loss of moisture after UV irradiation, while improving its texture. In mice, astaxanthin prevented skin thickening, collagen reduction and melanin production in response to UV light. In skin cells exposed to UVA radiation, the astaxanthin reduced the induced production of two proteins that break down the collagen, and a pro-inflammatory cytokine. This suggests that the astaxanthin could protect against UVA-induced skin photoaging, such as sagging and wrinkles. In a small trial on 21 cyclists, the oral astaxanthin improved the power output and the time trial performance. In a clinical trial on 40 male soccer players, oral astaxanthin improved the antioxidant status by increasing the activity of an antioxidant enzyme. Similarly, another trial on 32 male soccer players found that supplementation with the astaxanthin improved antioxidant status and reduced muscle damage after exercise. The antioxidant effects of the astaxanthin significantly delayed exhaustion in a forced swim test in rats. In dogs eating a protein bar with astaxanthin, immediately after physical exercise, it increased glycogen and protein production, thus helping to replenish their energy stores. A few small clinical trials and some animal research is insufficient to claim that the astaxanthin reduces the exercise fatigue, so larger, more robust clinical trials should be needed. In a clinical trial on 27 overweight people, supplementing with astaxanthin lowered the bad cholesterol and the oxidative damage, possibly reducing the risk of clogged arteries. Similarly, the oral astaxanthin reduced LDL oxidation in a clinical trial on 20 healthy volunteers. In another trial on 61 people with mildly high blood fat level, the astaxanthin reduced the triglycerides while increasing the good HDL cholesterol and a protein that promotes fat breakdown, adipositine. In mice, the astaxanthin delayed and it reduced blood clotting in blood vessels while increasing blood flow. In rats, rabbits and dogs, the pre-treatment with synthetic astaxanthin reduced the damage that was caused by heart attacks in heart tissue. Blood isolated from 20 people who were given astaxanthin showed reduced blood clotting markers, suggesting that it may help to prevent heart disease from blood clots. In a clinical trial on 45 people, supplementation with the antioxidants astaxanthin and sesamin reduced the mental fatigue and it improved cognitive function related to the ability to comprehend and to perform complex tasks quickly and accurately, which is the psychomotor and the processing speed. The astaxanthin improved the antioxidant status of the red blood cells in a small trial on 30 middle-aged and elderly people. This resulted in a reduced buildup of oxidized fats, or phospholipid hyperoxides, in their cell membrane, which is a risk factor for developing dementia. In rats, it delayed the brain aging by reducing oxidative damage and increasing the levels of a protein that promotes the birth of new brain cells, known as brain-derived neurotrophic factor. Pre-treatment with high doses of astaxanthin significantly reduced brain damage from a stroke in rats. Mice who were pre-treated with astaxanthin performed better in a learning performance test after a stroke. Similarly, it reduced brain swelling and it sped up the recovery after a traumatic brain injury in mice. Astaxanthin protected brain cells from beta-amyloid-induced toxicity, suggesting that it may protect against Alzheimer's disease. In a clinical trial on 44 people with type 2 diabetes, supplementation with astaxanthin for 8 weeks improved blood sugar control, it improved blood fat profile, and it lowered blood pressure. Similarly, astaxanthin improved insulin sensitivity in rats and mice on a high-fat and high-sugar diet. Generally, high blood sugar causes high levels of oxidative stress in diabetic patients. Astaxanthin can protect the pancreatic beta cells, which produce the insulin, from the oxidative stress caused by the high blood sugar, as was seen in the diabetic mice. It also reduced the cell damage due to glucose-induced oxidative stress in the brains and the kidney cells, suggesting that it may prevent diabetic neuropathy and nephropathy. In a pilot trial on 12 people with non-alcoholic fatty liver disease, supplementation with astaxanthin had no effect on liver function or sugar and fat metabolism, but it reduced fat buildup in the liver. In the same study, astaxanthin was more effective than vitamin E at preventing and improving fatty liver in mice who were fed a high-fat diet. It reduced fat buildup, liver inflammation, and tissue scar. Supplementation with 2 mg of astaxanthin for 8 weeks enhanced the immune response and reduced the production of inflammatory markers in a clinical trial on 42 young, healthy women. Astaxanthin supplementation enhanced antibody production and it decreased immune response in older animals. Combined astaxanthin and fish oil supplements modulated the lymphocyte function in rats. Cell extracts of the astaxanthin-producing algae significantly reduced the number of Helicobacter pylori and stomach inflammation in Helicobacter pylori infected mice. Mice who were pre-treated with astaxanthin before ulcer induction had significantly fewer stomach ulcers. In rats and mice with chemically induced mouth, bladder, colon, breast, and soft tissue cancer, the astaxanthin inhibited tumor formation and growth. In cell-based studies, astaxanthin inhibited the growth of colon, fibrosarcoma, breast and prostate cancer cells, and embryonic fibroblasts by activating tumor suppressor genes such as p53. Beneficial results have been observed at 2 mg in humans with dose-dependent effects at 8 mg. No signs of toxicity were found at very high doses in mice. I take 12 mg of astaxanthin with dinner each day. I exercise in the morning. An antioxidant taken at the same time as exercise can reduce the necessary inflammation that's needed for muscle growth. Therefore, taking them with dinner can speed up the recovery without reducing the muscle growth. Check out my video on other antioxidants like CoQ10, alpha-lipoic acid, and glutathione, and my video on antioxidants and its links to inflammation and autoimmune disease. For more information about herbs, supplements, or health conditions, check out my website.